Heart examination seeks a research method that tell everything about his condition. Interesting about science and medicine prepared by the editors of website netboleznim.ru. First method, angiography. Angiography is an X-ray examination of a thoracic vein and artery and heart chambers. A liquid radiopaque contrast agent is injected into a heart chamber with a catheter through a blood vessel, artery or vein. Angiography is done on an empty stomach and under local anesthesia. The examination takes about between 30-90 minutes. Angiography allows you to assess the state of the heart valves, especially the aortic and mitral, and the quality of the heart contractions. Method second, arteriography, visualization of artery. A radiopaque contrast agent is injected into the arteries that need to be analyzed. This test is done on an empty stomach. Arteriography can detect arterial cholesterol deposits as well as atherosclerosis or pulmonary embolism. Fifth method, catheterization to measure the blood pressure of a heart and large blood vessels. A catheter is inserted through a blood vessel up to the heart to measure blood pressure and cardiac output. This research method allows you to obtain data on the state of the work of the contraction of the heart and one disease of the heart valves. Fourth method, coronary angiography. Coronary angiography is a method of examining the coronary arteries. A radiopaque contrast agent is injected into each coronary artery after the catheter has been inserted into aorta. The examination is done on empty stomach. The duration of the procedure is 20-90 minutes. Some patients may experience allergic reaction to the injected chemical. This research method allows diagnosing a disorder of a coronary artery, myocardial infarction, angina pectoris, recurrence of narrowing due to atherosclerosis, assessment of their severity, and the appointment of coronary artery bypass grafting if necessary. Method 5. Doppler echocardiography. Doppler echocardiography is a test method used to visualize large blood vessel and to measure blood velocity. The patient lies on his back. The doctor places an ultrasound transceiver on his chest and examines the resulting image on a control monitor. The images are similar with an anatomical cut. This test measures the size of a heart cavity and large blood vessel, check the condition of the heart walls and valves, and look for blood clots and tumors inside the organ. Doppler echocardiography allows you to obtain such information: cardiac output, blood velocity, and the state of a contraction of a heart. Method 6. Doppler ultrasound of artery. Doppler ultrasound allows you to examine the arteries. The patient lies on his back. The doctor moves an ultrasound probe towards the arteries along the patient's skin and will measure the blood velocity. This examination allows you to measure the diameter of an artery and examine the condition of their inner wall. Usually the inner wall of the blood vessels is smooth, but when cholesterol plaques are present, they are irregular in shape. Due to Doppler effect, it is possible to identify cells inside the arteritis. Method 7. Ultrasound Doppler of vein. The patient lies on his back, an ultrasound probe is applied to the skin of the limbs and measure the speed of the blood. Doppler ultrasound of vein allows you to look at the vein, detect varicose vein and phlebitis, even in the initial stages. 8th method, electrocardiogram. Electrocardiography studies the electrical activity of a heart during rest. The patient is in supine position. The superimposed electrode on the wrist, ankles, on the chest are connected to a recording device. The graphs obtained on paper are analyzed by a doctor. This examination detects cardiac arrhythmia and sign of a coronary insufficiency. Also, an electrocardiogram is needed to monitor the progress of a treatment for heart disorders. Ninth method, electrocardiogram during exercise. This research method allows you to study the state of a heart during exercise and at rest. The method is practiced at rest and after exercise. The patient pedals on a bicycle or move on a treadmill. This research method allows you to identify coronary insufficiency and some cardiac arrhythmia. 10th method, daily EKG monitoring. Holter monitoring. Holter monitoring is done within 24 hours. This test examines the electrical activity of a heart over several hours. Electrode on the patient's chest record an electrocardiogram for 24 hours. The patient has a recording device and records all possible events during the day when can change the heart rate. Daily EKG monitoring is done in order to detect abnormal heart rhythms. Whether or not the patient has noticed is in order to find abnormality associated with coronary disease. Method 11. Intracardiac electrophysiological heart study. Intracardiac electrophysiological examination of the heart examines the electrical activity of the heart and abnormality in the heart rhythm. A flexible probe equipped with electrode is inserted into patient through a vein up to heart. Examination is done on an empty stomach under local anesthesia. This research method records the electrical activity of the heart, identify and clarify the mechanism or rhythm disturbance, tachycardia, bradycardia. Method 12. Magnetic resonance imaging. The magnetic resonance imaging can analyze the dimension of the cavity of the heart, large blood vessel and blood flow. The patient is in a supine position inside an electromagnet. Obtaining static image of the section and imaging the movement of the heart. It is possible to visualize the artery. Thanks to magnetic resonance imaging, you can identify the following disturbance: abnormal dilatation of a large blood vessel, aneurysms, pericardial abnormality, valve disease, congenital malformation. Method 13. Ambulatory blood pressures measurement. The survey allows you to confirm the diagnosis of hypertension. Method 14. Phlebocavography. The phlebocavography allows you to study the condition of a vein of the lower extremity and the inferior cava vena. An opaque X-ray contrast agent is injected to examine the deep vein in the legs, thighs and lower abdomen. Phlebocavography can detect blood clots, which can be the main cause of pulmonary thromboembolism. Method 15. Scanning and angioscanning. The patient is in a supine position under the influence of X-ray. The procedure takes about 30-45 minutes. This examination allows you to examine the size of the active cavities of the heart and large blood vessels, as well as detect decrease or arterial obstruction. Method 16. Myocardial scintigraphy. The patient is injected with a weak radioactive substance, gallium, technetium, thallium, and a video camera records the final radiation. This examination allows you to study the circulation of the heart and identify coronary heart disease or the consequence of myocardial infarction. That's all. Thank you for your attention. This material was prepared on the basis of an article from the website medballistening.ru. This material is for informational purposes only. When observing various unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thanks. Bye bye.